but that other people that they love and admire and care for, their needs would also get met.
What about AI?
I want to collaborate with you on AI.
Caroline, you want to start?
Dr. Caroline Finkel, Chief Clinical Officer and co-founder at Charlie Health.
I'm Clark Dwoskin, VP of Care Strategy and Care Delivery at Charlie Health. All right. How do the care strategy and care delivery teams complement your clinical team's work?
When I think about the work that the care delivery and care strategy team does for the clinical team, I think a lot about this idea that the clinical team is just like the basketball, and the care strategy team would be like the coach, and the care delivery team are actually the players. And so, essentially I like to think of it as like we're all working together, and the care delivery team is really helping to place all of our patients into the right places at the right time to ensure that they get the best quality care, while the care strategy team is helping to come up with a strategic vision and a strategic plan of how to get the basketball into the hoop. Which sounds really corny, but it's the truth, which is to be able to have them have a complete discharge and help them to get their life back on the path that they were hoping for it to be on.
You come up with the basketball metaphor on the spot?
Yeah.
Wow.
Thanks. I've been thinking a lot about basketball for some reason. I don't know why.
Nice.
All right, do you want to ask it again and I'll give you a whole new metaphor?
Should I respond to it? Do we just...
Okay, here we go. Describe your team in one word.
Can't be care.
Agile.
Why did you choose that word?
I don't know, because I had to pick one word.
Okay, well, why did you choose agile?
Because we do a bunch of different types of work with a bunch of different teams across the company. So we often have to change our approach, change our mindset, change our communication style. Like day to day and even like meeting to meeting. Like we go from having a conversation, like an analytics conversation about like a data set and like how we're trying to get data from this product feature to that place, into a meeting where we're like talking with clinical directors about the therapists that work for them and challenges they're facing in their day-to-day. Very different types of conversations. Describe your experience of working at Charlie Health in 3 words.
Piece of cake.
No way.
No, it's the exact opposite.
Yeah.
Going to war. Okay, 3 words, experience at Charlie Health. Powerful. Transformative. And eye-opening. I think that when I think about the work that we've done at Charlie Health, I think a lot about the exponential factor that we have created here and the power that we have had on so many individuals' lives. And when we started, we just had one. And I don't think that we had any clue that we would have impacted 25,000 lives in just a short 3.5 years. And I think a lot about the power that has throughout the country, and then just how that's going to only grow exponentially, which is just mind-boggling to think about.
Nice. How'd she do?
What do you like most about my team and working with us? Other than me, of course.
That I get to work with you every day.
Oh, so sweet.
No, I think that clinicians and clinical directors that we work with approach problems very differently from the way my team or I approach them as someone with a background in consulting or operations. And they challenge us like in a really good way. They challenge us to put patient experience first and to try to solve problems in ways that we wouldn't have on our own. And also, it's just a good vibe most of the time.
What do you think makes it a better vibe?
No, they know the patients and they know the clinicians the best, and like those are the two groups of people that my team is trying to serve, and they spend all their time thinking about those problems and actually like living the experience. Nice. Nice.
Piece of cake.
That's funny.
Going to war.
Yeah.
I hope that it makes it in there.
I think it should. I don't see any reason